Good morning, everyone. I'm Johann Hernandez, an engineer at City Labs. I would be joined by the CEO of the company, Peter Kabawi, but unfortunately he couldn't make the trip. I'm going to be discussing the regulatory pathway to commercialization for our nuclear battery that's going to be incorporated in a OEM leadless cardiac pacemaker. So to begin explaining and dissecting the problem, you have to look at the decades-long history of transvenous pacemakers. Historically, transvenous pacemakers are consisting of two components. The first being a subcutaneous implanted pulse generator, and the second being leads tipped with electrodes that are routed through the veins to the heart. Recently, as you can see on the right-hand image, these have been supplanted with a breakthrough technology called leadless pacemakers. These are a fully self-contained system that's endovascularly routed to the heart's chambers and implanted inside of them. This provides pacing with no lead-associated complications or pocket-associated complications simply because those components are not a part of the system. This has greatly reduced post-op complications in most patients with a reduction rate of around 10 to 15%. However, these pacemakers are only used in patients who are usually around 65 years of age or older, and I'll go into why. The reason for this is that chemical batteries, generally with lithium chemistry, have lifetimes that are far too short to justify putting these pacemakers in patients who are below the age of 65. The reason for this is that retrieval or replacement surgery of leadless pacemakers is complication-ridden when compared to the first implantation. So intervention is usually not conducted by electrophysiologists. A solution to this issue would be creating a longer-lived device, and that's where our technology comes in. Since leadless pacemakers with current generation lithium batteries generally have a lifetime limit of around 10 years, a nuclear battery lasting 20 years would be a great solution to expand to this patient population to a much younger demographic, perhaps those in their 40s and even 50s. Furthermore, our technology allows for the miniaturization of these batteries down to the 0.1 cc level, which would reduce hemodynamic complications and heart failure associated with the continued use of these devices and even reimplantation in cases where it's necessary. So the way that this battery works is that you have a always-on power source that is made of two components. The first being a beta voltaic cell, similar to a solar cell, and a tritium source. The tritium source is a thin film metal hydride that is sputtered onto the beta voltaic cell and emits beta electrons into the beta voltaic cell, essentially energizing it and causing current and voltage to be delivered to the load with which it's connected to. As an always-on power source, we're able to develop a battery with a much higher energy density because of both its miniaturization potential and its use it or lose it power, which you can tap into and has a fixed lifetime of 20 years, as informed by tritium's 12-year half-life. So if you look at this chart, which illustrates the energy density, capacity, and volume of City Labs battery compared to industry standard Medtronic and Integer batteries, which are used in the Medtronic Micra and the Abbott Avior, you can see that City Labs battery far outperforms them in every regard. So what is the natural path to commercialization for our device? The pacemaker space as a device manufacturer would be very hard to break into, as companies like Medtronic hold a massive market share with numbers like 40% or so. So we have decided to opt for becoming a component or supplier of components to these LCP OEMs. And we are in close conversations with a specific LCP OEM who has a much smaller market share than the others, making them very hungry to break into the market with a technology that will provide a huge advantage to the other pacemaker manufacturers. So in talks with them, they have proposed a testing and evaluation scheme, like a pilot study to us, which will involve a 3-year testing and evaluation of batteries that we deliver to this LCP OEM. So to be clear, the key experiment conducted for our device's eventual commercialization and integration with a leadless pacemaker will be conducted by the LCP OEM strategic manufacturer, or strategic partner, I apologize, not by us. We will obviously qualify everything that goes out to the partner, but they will be conducting the final regulatory submission through a supplement to an existing PMA on their leadless cardiac pacemaker. So just want to make that very clear. And yep, I'll go through a few of the steps in this study. So our pilot study will be, as I mentioned, a 3-year study with this leadless cardiac pacemaker manufacturer, with the first one being the delivery of 200 to 250 batteries for qualification by the LCP OEM. This will ensure that these batteries do not experience temperature generation difficulties that heat up the titanium casing of the pacemaker, as well as qualify the base electrical performance of these batteries for eventual integration into the pacemaker. The second year will involve the integration of 500 batteries with the leadless cardiac pacemaker manufacturer's device and the testing of these in a phantom model, essentially testing whether pacing can be achieved with a tritium beta voltaic power source. This will also quantify the hermeticity and physical leak of the battery, as the tritium in the battery can leak out, as hydrogen is the smallest atom known to man. So that will be important in projecting out dose. And lastly, we'll be conducting validation in coordination with this leadless pacemaker manufacturer. We'll be delivering 250 more batteries to them to integrate in their device and implant in a porcine or canine model. They'll be calculating the tritium dose received by the animal, and they'll be assessing the complication rate post-op. So these are the key experiments, and we've received a very extensive amount of standards from these pacemaker manufacturers detailing what we need to adhere to when it comes to MRI safety, communications, and various other factors that are taken into account. We'll be revising our quality management system, which is right now currently optimized for the defense applications that we've mainly worked on to meet those of pacemaker manufacturers and the FDA. So to illustrate this timeline, this is happening in the next couple of years. So we plan on bringing our full tritium handling system, which rivals the capability of national labs like Lawrence Livermore or Oak Ridge, to be fully operational in Q2 of 2024. This will be supported by the funding received from an NIH Phase 2B application, which will allow for us to further develop this relationship with a strategic, and we'll then begin in 2025 the qualification of our tritium batteries, this first year 250 battery stage, which will end in 2026. Verification will end in 2027, and in 2028 we'll have finished validation and the pilot study. Preclinical data gained in this study will be used to support the supplement to their existing LCP PMA and to bring a tritium-powered pacemaker to market. Now, what does this mean for the pacing market? This means that hundreds of thousands of patients who have previously not had access to leadless pacing with less complication rates will now have access to that kind of pacing modality. Furthermore, this is further compounded by the innovation shown by Avir, which is Abbott's dual-chamber leadless pacing system that came to market last year, which already broadens the use of leadless pacing to a far higher variety of indications, including those who require multi-chamber pacing. Furthermore, I think it's important to add that we at City Labs have conducted an FDA pre-submission in which we met with various reviewers and discussed radiation dose, how it's going to be a non-issue, and that electrophysiologists actually are willing to make the trade-off between a low radiation dose equivalent to around a single full-body CT in exchange for this longer pacing duration. So with that, that concludes the presentation. I'm Johann, and I'd like to extend a extremely, I'm very grateful to everybody who has given us feedback and helped us modify the presentation. Very grateful to Aaron for helping us stay on track, giving us feedback, and to Mike for showing up to all of our meetings and keeping us in check. So once again, thank you for your attention, and I'm happy to answer any questions.